Chris Walker, Emergency Preparedness Coordinator for the Hamilton County Health Department, joins me this morning. Good morning.
Hey, good morning, ma'am.
So how are we doing numbers-wise? It looks like we're headed in the right direction still.
Yes, we're still heading downward as our daily cases of COVID-19 decrease. Our positivity rate for all tests right now is 7.1%. That should get us much lower on the county advisory level, and hopefully we can keep going. You know, ultimately our goal is 5% or lower. So we're heading that way, and that's a great thing.
Now, we don't want to get too optimistic about those numbers. We still need to be very vigilant.
That's right. You know, we still have plenty of testing available throughout the county. Folks that are symptomatic should still go get tested. You know, we'd highly recommend that. You know, the vaccine's coming online, which is great, but that's not, we're a long way off from that providing a positive impact on the county level numbers at this point.
Let's talk about vaccinations. Today we hit a real milestone up at our location, at least.
That's right. Today we started second doses for the folks that came in and saw us on our first day of operation back on the 11th of January. So we're really excited about that. And it looks like to date, we've had 41,234 people receive their first dose here in Hamilton County.
So you got to see all of those people all over again.
Right. Well, yes, we're seeing all the people that we saw on the 11th again today. And, you know, from here on out, we're going to start seeing second doses every day. The other great thing is we have over 17,000 people in the county that are fully vaccinated at this point. They've received both doses of their vaccine. So,
well, and the other good news for you guys is you've got some extra help coming online. Tell us about that.
Yes, the commissioners, emergency management, all our partners have been fantastic about recognizing how important vaccination operations are, as well as our continued support of normal public health operations here in the county. And we've been able to engage for some contract services to come assist us with our vaccination operations. That'll allow us to get back to doing the normal vaccines that we normally do on a day-to-day basis, as well as continue our food inspections and some of the other things that we've had to kind of curtail while we were getting vaccine up and running.
Yeah, let's talk about that, because it really has been an all hands on deck process, and half of the office, or more than half of the office, spends its day over at the fairgrounds giving vaccinations. So what is the important work that these guys are going to be able to get back to their office and do?
Sure. So about 80% of our office has been dedicated to vaccination operations right now. You know, the birth and death certificates, those have still been going on. I don't know if everyone's aware, but the state has also transitioned to a new vital record system during all of this as well. So those folks have been learning that as well. But, you know, our folks do the food inspections at all of the restaurants and food establishments within Hamilton County. We inspect septic systems before they go operational, or if they have to be re-inspected for some reason, things like that. We do water quality. Typically that is a summer job, but, you know, we do have indoor pools at some of our hotels and other venues. So that does keep them going as well. A myriad of normal vaccines that we give, tetanus, HPV, and some of the others. We'll get back to doing those more as well. And of course, you know, it may be February, but that means spring's right around the corner, and that means mosquito season is coming as well. So our vector control operations will start picking up here very shortly as well.
So there's still a lot of important work that needs to be done that is not even COVID related.
That's right.
Get you guys back in the office and working on that. Anything else you want people to keep in mind or to consider as we move through the week ahead?
Well, you know, I think we've talked about it for a few weeks now, but, you know, vaccines are great, but the vaccines are not 100% effective. Those folks that are fully vaccinated still need to be wearing their masks, still need to be socially distancing. Just like folks that have not received their vaccine or have only received one vaccine. Additionally, you know, if people are sick, they're not feeling well, they need to stay home, they need to get tested. You know, all the things that we've been doing for the last year, we need to keep them up a bit longer here, and we'll get through this one.
Sounds good. Chris Walker with the Hamilton County Health Department. We'll check back with you next week.
Thank you, ma'am.